Good afternoon, everybody. Welcome to our COVID-19 update. We are here today on a Thursday because of significant announcements from the state, as well as to share an update about what we're doing locally. It is Thursday, May 14th. Thank you, everybody, for being here. Today feels momentous for many people. The truth is, this virus is novel, and it is not paying attention to the court order. I will tell you that. It's paying attention to what's happening in our communities. But we have to pay attention to court decisions, and we are. We in public health and in incident command broadly in our community as a whole are really focusing on the fact that this is a worldwide pandemic that has had significant impact across the U.S., across Wisconsin, and across the world. Nobody in this community, I know, wants to lose our focus on paying attention to the disease, on flattening the curve, on making sure that we have spread happening in a controlled and slow way, not in a way that is going to cause an enormous impact to people's lives, more deaths and more people impacted that we can't take care of because of our system consequences. We know that those consequences can be big. We've seen it in other states, and we've seen it across the world. And Wisconsin has been doing a really good job. If you look at the data, while we have had a significant number of deaths here, we have done a lot of testing here, we're in a better spot than many other states, and that's because of all the hard work that everybody's been doing across the state to keep their circles small and to control the spread. Today, we'll share a little bit about the data, like we always do, and then we'll go to discussing the ending of the Safer at Home order, emergency order number 28. We will also share the local order that was just signed today. I'm joined today by a number of people across our community that have worked with us as we've developed that local order. The press release today, as you may have seen, was announced by Eau Claire County, the City of Eau Claire, the City of Altoona, as well as the Eau Claire City County Health Department and Board of Health. A strong partnership. Dale Peters will be sharing some comments after I share an update about what's going on, and then we will be available for questions. Our state update related to our data. We now have 122,598 negative tests for COVID-19, an increase of almost 5,500 negative tests. Positives are at 11,275, an increase of 373 positive cases of COVID-19 in the state. Of those positive cases, 1,939 have been hospitalized. Again, this is a decreasing hospitalization number of those that have been tested as testing has increased. We are now at 434 deaths in the past month since this pandemic started, an increase of 13. This number keeps climbing. It's a deadly disease. It's not just a coronavirus that gives us a cold. It is a coronavirus that is killing people, and killing people across the age span, and killing people that may not have pre-existing conditions. It's why it's so important to protect each other. Not only do we have vulnerable populations that are particularly at risk, but we also have populations that are dying that don't necessarily have risk factors. In Eau Claire, we now have 3,468 tests for COVID-19 done. That's an increase of 263. I think people are well aware that our numbers have gone up significantly because of our community testing on Sunday and Monday. Our negative tests are at 3,261. Our positive cases of COVID-19 are now at 65, an increase of 2. 40 of our 65 individuals have been released from isolation. The rest we are continuing to follow. We're waiting for some final numbers from our partners related to that community testing event on Sunday and Monday. Hopefully we'll be reporting that to you with complete data tomorrow when we meet again. We also know that the big news today, besides the numbers of COVID-19 positive, is the update on the state's Supreme Court ruling. Order 28, which was the order that was challenged in the Supreme Court, was overturned in its entirety, almost in its entirety, by the Wisconsin Supreme Court yesterday. We got that announcement late in the day yesterday after we already spoke during our news briefing yesterday. The small exception is related to the closing of schools, which remain closed through the end of this school year, the 2019 through 2020 school year. The opinion that was given by the state Supreme Court was very long. It is still being digested. The attorneys are across the spectrum are continuing to look at that order, the opinion, and there are remaining many questions. I will acknowledge that to you. I just left a phone conference with the Wisconsin Counties Association where local health department directors were meeting with that group talking about the order. So we know there will remain many questions for a few days until it's fully analyzed and we have all the resulting opinion questions. There are many concerns about the lack of clarity in the opinion that was provided, and it's unusual. So we do have an opinion that does have a significant lack of clarity to it, and we're working through that. As I've said to people regularly, our local goal has been consistently about stopping the spread of this pandemic. We know it will spread. It's not about stop, really. It's about stopping the increase happening in a way that is not manageable. We've been doing that. We know this disease doesn't have boundaries. While we have few cases here, it's because the Safer at Home order was put in place early compared to the spread of disease here. As we've slowly dialed back on that Safer at Home order across the state, we've known that we will see increases in disease, and we are seeing that. We know over time, with increased opening of our society, we will slowly and hopefully strategically have increased disease in a way that can be managed. It's a disease that none of us at the start of this in January had immunity to. It is a disease at that point in time that we all had the potential of getting. We know that disease and death will continue to happen, and the ending of this order without a replacement creates an incredible challenge for our state. In the short term, the order ended yesterday. That did mean that local health departments across the state were then left in a position to make decisions about use of a local order. We do have authority under state statute to have local order for control of communicable disease. In the end, in the short term, the only solution for local health departments with managing this disease was to do a local order. We continue to be working with our state partners at the legislative level as well as the executive level to support ways that we can have a state solution to this pandemic. That is what other states are doing and is the right thing to do. I am supportive of having a state approach to how we deal with this disease moving forward. In the short term, we've done a local order that we released this afternoon. That local order focuses on the risk associated with this disease. It is very specifically targeted to focus on this specific disease, the risk of physical distance, and the risk of group gatherings. And it really walks through those two risk factors and does provide a framework for us in this community to support not having disease spread quickly. It does change what is the order from yesterday that we were under at a state level. The truth is that it continues to mandate keeping our circles small, like we've talked about regularly, and keeping physical distance. I can walk through some of the specific questions if you'd like as we do questions, but it does mean that certain activities will not be allowed anymore. It does not include a mandate for everybody to stay home, but it does include an order that in those situations where we are out of our household situation, that we are keeping physical distances and keeping our circles small. Our priorities in this community, like across the state, continue to be about testing a lot and regularly, making sure that we have testing of all symptomatic people in all cases. That is a priority that we continue with, and we are working with partners on that. Contact tracing when we find disease, making sure that those people that have disease are identified through testing and those that have disease stay home and their contacts stay home. We are in that phase of this pandemic to focus on making sure that spread is small. That's called the containment phase, and that's where we are at. We also will continue to focus on building healthcare capacity and public health capacity. That includes making sure we have enough PPE, personal protective equipment, making sure that we have enough people to do the work that we will have to be doing as the disease numbers increase, and the people to follow data and making sure that we know what is happening. So when and if we get to a point where we can't manage the disease burden, that we are ready for that and we respond. The goal at this point is to have quick response to known disease and to keep those circles of disease spread as small as possible. Our order does support the WEDC guidance for opening business and specifically calls that out. The WEDC guidance is also what frames our Chippewa Valley Economic Recovery Task Force that you've heard regularly about on these media briefings, and is a critical endeavor moving forward that we have in order to make sure that all of our business entities are supported in doing the right thing. We have had amazing success in this community with individuals, all of us, and businesses making choices to do the right thing that they know will make a difference in spreading disease to their loved ones, to their family members, and to the people that they work with. We'll continue that work. We've been doing it already. The Chippewa Valley Economic Recovery Task Force is the place that work will be focused along with the WEDC guidelines. And we will continue through Incident Command to support that and make sure that people have clear understanding about how not only this disease spreads, but how we prevent it through use of those tools. I'm really proud of the people in this community. You have done what you've needed to do to this point, and we know that we'll continue to do that work together. Our order locally goes until 11:59 p.m. on May 28th. That's 2 weeks from today. We will be regularly reevaluating that order based on what's happening locally as well as in the region and state. We put together an order rapidly. We know it is not perfect, but we are doing our work today to make sure that we are doing the responsible and required work of a local health officer to control communicable disease. That is my job. That's what the state has mandated us to do at a local level, and we are taking that responsibility on today with that local order. We have a starting point today. We know we'll be updating as appropriate. This is not a date-sensitive order. It is a risk and data-framed order, and we will be continuing, as I've said regularly, to focus on risk, to focus on data, and to be working with our community partners to make sure that we have our economy supported as well as all of the individuals in our community. Dale Peters is here. I think everybody knows he is our city manager for the city of Eau Claire. He's also the person that has been playing a key role in getting the Chippewa Valley Economic Recovery Task Force pulled together. The press release was done in partnership, and the order was done in partnership with our key governmental partners, Dale being one of those. I appreciate the work that we do together, not only the last 24 hours nonstop, but also really for all of the critical work that we have in this community. So Dale will share a few comments, and then I'll be back to answer questions.
Thank you, Liska. It has been an interesting 24 hours. Just so much work to react to what, of course, was just pointed out, that the Supreme Court struck down the safer at home order. And so what that meant is that we found ourselves in the middle of a worldwide pandemic without guidance from the state and expectations that we deal with that at the local level with fewer tools in our toolbox. I think it's important that when we think about solving a problem, that we understand the problem that we're trying to solve. And I'd like to just point out some things that I hope we all agree on when we're thinking about this problem we're trying to solve. One is that this is a highly contagious disease. It spreads quickly and it kills people. Second, that we want anyone and everyone who is sick with COVID-19 to have access to medical care. That means, as Lisa pointed out, we cannot put ourselves in a situation where our medical facilities are overwhelmed and can't treat people. Third, that we want a functioning economy with people engaging in commerce safely and without fear of becoming ill. And finally, that there's value in having reasonable rules that protect the health and safety of everyone in our community. So today, the leadership from the City of Eau Claire County, and the City of Altoona, through the authority of our local health officer, Lisa Giese, we're using the tools that are available to us to implement rules that are designed to help prevent the spread of disease and prevent our healthcare systems from becoming overwhelmed. These rules are centered on sound public health principles of physical distancing, limiting mass gatherings, and keeping the numbers of contacts small. Rules to strategically open our local economy using data and metrics. But let's be frank, this will not work if you and your family don't believe there's a problem. But there is a serious problem, and it really is not a matter of if, it's a matter of when each of us are going to know somebody that becomes sick, disabled, or dies from COVID-19. And the only way that we can help those that become sick from becoming disabled or dying is to not overwhelm our healthcare system. So please, for the sake of your loved ones and your friends and your coworkers, take the time to understand these guidelines. Some of them are voluntary and expectations, and some of them are rules with a local health order. Take the time to understand them so that you can protect yourself and your loved ones. This is, as was pointed out, a community problem, and it will require a community-wide solution with community-wide support. As has been said, we have been successful. We've been very successful so far because we acted as a community, supporting one another to slow the spread of this disease. And yes, the rules have changed, but our commitment to opening up our economy in a way that's safe for our residents, our employers, our employees, and our customers within the community has not changed. We must find and have found a logical, practical path through this. But again, these rules and guidelines will only work if everyone does their part to protect the health of their family, their friends, their neighbors, and their coworkers. None of us, no one in this community wants to take a step forward only to be forced to have to take 3 steps back. And let's acknowledge that none of this is easy. We all have fears and we all have worries. It's really hard. This is hard for all of us, and each of us are carrying our own burdens and our struggles to move from day to day through this. We worry about the health of our loved ones, we worry about our jobs, we worry about the ability to care for our families, and we worry about what the world is going to look like when all this is over. And of course, none of us can tell you that everything's going to be okay. But I can tell you that I and all of us here believe in our ability to navigate our way through this as a community, with dignity and grace and compassion for each other. And I believe that we have the capacity to solve this difficult challenge and to come together in a way that will allow us to emerge from this dark cloud and sail into some sunnier, calmer waters. So thank you for listening. You have to listen to a lot. There's a lot going on. But thank you for listening to this message. Thank you for having grace with the situation and grace with those that are around you. Thank you for the little and the big things that you're doing every day to protect the health of others, because by working together as a community, we will see a brighter future and a better Eau Claire.
Thanks very much, Dale. That really, I think, helps us all to pause and think about, what we are all working on together. So thank you for that. We are now available for questions. Yes.
So places like bars, tattoo shops, barber shops, places that weren't open yesterday but could open as late as yesterday. What does this local order mean for these places here in Eau Claire County?
The question is, what happens for places that were not able to be open yesterday per the Safer at Home order? What does that mean for them today with the local order? The guidance in the local order gives very specific directives around the risk of physical distance and numbers of people. And so every one of those establishments, by place is not identified as being in or out of the order, but really about their practices. Are they able to have social distance? Are they able to keep the numbers small? And so every business will have to review that order and make that determination.
So I guess, just to clarify, if a bar says, we're opening it up, but only 10 people can come in, that's okay under this order?
So the question is related to if a bar, as an example, says we are open with a certain number of people in. Again, the guidance in the order does not, in that setting, talk about a specific number explicitly. It's based on their square footage and how many people in their specific square footage can be in that location. If they can meet the requirements in the order, they are allowed to be open. Yes?
Again, some clarification on that. Are there limits on any business? You know, it talks about not mass gatherings of 10 or over 10 people, but kind of like what you said, you know, what's the metric? Like, you know, how many people per square footage or per?
So the question is related to the metric. I know this order just came out for people to digest, so I want to acknowledge that. I will share with you that in the order there is explicit language about public spaces, both indoors and outdoors, and public buildings. In that language, the specific language is those entities, so this is really all businesses in Eau Claire County, need to comply with physical distancing requirements of 6 feet between all individuals on the premises. They also need to allot a certain square footage, 144 square feet of space between household units if they are in a situation where a group of people is together. An example of that might be a restaurant where a table of people is together. There is explicit language that each business will have to look at and review to see in their space what is allowable. All of those spaces obviously would be able to continue with their takeout service where there is not in-person opportunities for having to comply with the order. But those places that have indoor and outdoor and public building spaces will have to walk through the order and determine if they can meet those requirements. It is not business specific, it is risk associated. Yes?
Lisa, could you please talk about the enforcement of this new order?
The question is related to enforcement. In state statute, the local health officer does have authority to have a local order. Our enforcement and the language that is in the order is that the order is enforceable by any local law enforcement official. Violations may result in the issuance of a citation. Our goal with this order is to do no citations. Our goal with this order is to educate. It has been a consistent message in this community, and we will continue with that. Our first conversation with any location is about education. This is a brand new order. Nobody has had yet really time to digest it. We understand that. We've been talking a lot about risk. Risk is the frame for the WEDC guidelines that have been available for about a week now. Those guidelines really talk and walk through risk based on place and give a very good starting point for all businesses in this community. We know that our businesses have already been looking at those guidelines, and we've had lots of conversations with businesses as they've anticipated opening, and we expect to continue that as well. Again, our goal is not enforcement. Our goal is prevention of disease spread in a way that is so rapid that we can't control it. So there's no value for any of us in having to go the enforcement route. The value is for all of us to understand risk and to bring that risk down at this point in time based on physical distance and numbers of people gathering at the same time. Yes?
Lisa, correct me if I'm wrong, but this seems to, the new order seems to maintain many of the protections that were in place under Safe Red Home. Can you tell me the major differences from what was to now?
Mm-hmm. So the question is related to what are the major differences between the previous order, the Safer at Home statewide order, and this order. This order does not designate any specific type of business with any specific requirements around it. This order is based on risk with very specific framing of risk around the requirements to reduce that risk, focused on numbers, focused on physical distance, and a number of other items in the order that we could talk through if you'd like more details. The previous order started with everybody staying at home and being mandated to stay at home. This order does not start with that starting point. It starts with everybody keeping their circle small, your household small, and that recommendation being strongly there. And then from there saying in public spaces and in public buildings and with mass gatherings, making sure that we have the controls in place. The order does talk through some specific things again around physical distance and numbers to keep the spread low. One of the specific questions we've already gotten is related to religious gatherings. And again, religious gatherings do have some specific constitutional frame that does mean that they are not limited in the mass gathering part of the order, but they will be expected to meet all of the other requirements in the order related to physical distance and space. So examples of something like a religious gathering would be a difference from what we have now in the current order, but would be looked at again using risk-based criteria that are very clearly outlined for all businesses and types of venues across our community. Yes?
Nice. So if employees don't feel comfortable going back to work, what provisions are there so that they don't get fired?
So the question is related to what happens if employees, given this order, are not comfortable returning to work. This is a very clear order only under the direction of our communicable disease statute for prevention and control of communicable disease. Certainly, employee-based provisions are something that are critically important, and we support employers having safe places for their employees to work. And those questions will be part of what we work on in the Chippewa Valley Economic Recovery Task Force, but certainly a starting point is any local employer's route of concern and complaint starting there. I don't know if, Dale, you want to speak any more to that, but our Recovery Task Force certainly has that as part of their concern. We view businesses as partners in making sure that health and safety is strong at their institution or in their business environment. It doesn't do any business any good, and we've heard this regularly from all of our businesses, to have either employees not healthy and not able to work, or have customers worried about the health of being in their business. They won't have customers and they won't have employees if we don't do this right. Businesses across this community have been wanting to do it right, and I expect that to continue. Yes?
Throughout this whole process, you've been very vocal about the importance of partnerships with the other county health officials. Was there any talk of a regionalized order, or does it concern you that county by county basis there could be different things that people are being told, and people from Eau Claire could go to Chippewa or Dunn and go do things that aren't allowed here?
Sure. So the question is related to having what I've called a patchwork quilt of orders across our state, that we are left with the Supreme Court ruling being one where we could have very different orders across the entire state. We've already seen that. Many people have seen already existing orders in Madison-Dane County and Milwaukee area and Brown County and other orders. We will have different local orders. In this part of the state, we are working very carefully together and very consistently talking about how we can have commonality with our orders. We're also working across the state, so I've been on a number of phone calls the last week, but certainly today, about how to share best practices in our order development and try to have common language. In this region, we specifically worked together to share the template that we developed here locally. We did that with a couple of our other local health department partners, and we're hoping that there will be some consistent language throughout the region. We know that that's a local decision, and a local order is bound by the the frame that the local health officer has in order to make that local decision, but we're hopeful that there will be some consistency across the state. In the end, this is the same disease in our entire state, in our entire world. How we deal with it is the same public health principles, very frankly. We contain this disease by distance and by small numbers. And so public health officials are working with that starting point. The state did that, and now local health departments are doing that, and we're hoping that we have minimal impact of, frankly, political push to do something other than the right thing to control this disease. It may happen, and we will have to sort through that. My goal is that we have a strong state framework moving forward, and that will take some time. That will either be a legislative decision or an administrative rule decision, and both of those take some time. But the hope is that we'll have a state way to move forward. Yes?
When should people expect to have an update on whether or not this is going to be extended? You said this is just a 2-week order. Should people assume that this is kind of going away around, May 29th, or should folks expect it?
Yeah, thanks for that question. The question is related to the end date of the order that was started today. That is 2 weeks from today. That decision was made for that 2-week point so that we would have an order that was not going on forever and not signaling that we had that intention. It's a starting point. It will be reevaluated very regularly. We know that, like the state orders, as questions started about how will this really work, we are intending to look at it regularly based on the questions that are posed. We also will be regularly looking at it related to data. So I would expect that you will all get updates at least weekly on where we're at, and we certainly partly have this 2-week frame to see what happens with the state legislature and what happens with the governor's office. We're hopeful within that time frame we'll know more, and we can start aligning with what we're seeing across the state. Yes?
Do you expect to see a spike in cases because of all these gatherings, and are area hospitals prepared for an influx of cases if that's the case?
So a double question, one related to, are we expecting a change in our case numbers based on the ending of the Safer at Home state order and the start of this new order? And are we prepared for that, both hospitals and other partners? Public health is the other partner that will be dealing with that. I expect that no matter what the order is, that we will have an increased number of cases. I've said that regularly, not connected to the change in the order. As people are out in the community, this disease is very contagious. Dale mentioned that during his comments as well. We will see people with the disease. As more people go out, which will happen with this new order, we expect that those circles are going to start expanding. Our ask is for, again, people to keep their circle of contacts as small as possible. That will help slow the increase in disease. But we do absolutely know that we will see increased disease in this community. Safer at Home, or that order, started at a point in our community where we had very little disease. So we are now starting to open back up at a time where we likely will see a climb in numbers not dissimilar to what's happened on the eastern and southeastern side of the state. We expect to start seeing that here as things open up a bit more. This order helps slow that down a little bit. That's the purpose of us doing a local order. Opening the gate without a replacement would be, frankly, an irresponsible thing for us to do. We need to make sure that we have a slow progression of disease over time. Are we prepared for it? That's what we've been working on for the last 6 to 8 weeks. We certainly have a strong healthcare system in this community. We certainly have a strong public health system in this community. This is an unprecedented disease, though, so we are working to build capacity. We are working to have enough PPE, personal protective equipment, available, and we are short of those goals right now, but we continue to work on that. We are prepared at this point to respond. Our healthcare system certainly has not had to respond, and we are confident that we will continue to work together to make that happen. Yes?
Could you speak to individuals and business people who might have questions about the order? What's the best way for them to pursue that?
Yeah, so the question is related to those people, both individuals and businesses. What's the best way as they think about a new order being in place, which is difficult, again, with the order that we've been living under for a number of weeks now being gone. This new order will take some time to digest. My recommendation is to go to our website. Again, our website at covid19eauclair.org does have the new order posted. We will be developing some questions and answers, a frequently asked question document that will be there shortly. As you can imagine, we just got the order finalized, so we are now working through that FAQ document that will also be posted. Read the order, spend some time thinking about what that means for you individually, what that means for you as an organization. Our Chippewa Valley Economic Recovery Task Force will also be looking, I'm sure, carefully at the order. They will be spending time business sector by business sector looking at that to see implications and working through the WEDC best practices to really help us think about how that's going to happen actually in Eau Claire. We very deliberately did not do a business sector order. We did a risk-based order because this is a public health order. We know that the business sectors will be working through that and helping us apply those public health risk factors in a way that will be successful. Yes?
Can you talk a little bit about, it says in the order here, adopt policies to actively screen and prevent customers from entering premises if they have respiratory symptoms, etc. Are businesses going to be required under this order to screen customers, temperature checks, things like that?
So there's a specific provision in the order related to having policies as a business to make sure that they are actively looking at disease of both employees and customers. Our expectation is that there will be a policy in place. We will work with businesses around what that policy looks like. Some places have signs on the door. Some people do active screening. Some people have a person that's asking questions. There are all different ways to do this. We're not mandating a specific way. We are certainly available to answer questions about some of that best practice, and there are certainly many guidelines available at reputable websites like CDC and the State Health Department website about how to do this. This is one of the basic best practices that exists in every document that I can think of, is actively paying attention to people that are symptomatic with COVID-like symptoms, both employees and those entering a premise, to make sure that we're not spreading disease in those environments. Yes?
If the governor or the legislature were to come up with another order within the next 2 weeks, would this prevention and control order become void then?
So the question is related to if the governor or the legislature, if there's either an administrative rule that moves forward or a legislative law that moves forward, what would happen to the local order? That would be entirely dependent on how either of those were written. We certainly would be looking at that carefully as that progressed. We are providing input to both of those bodies to try and have alignment around the idea of risk. And we will be reviewing that and making a decision locally dependent on what the results are. So difficult in specific to answer that question until we see what moves forward at a state level. We certainly have as a goal the ability to look at this as a statewide, a national, and an international disease. Again, this is not a local outbreak with a local solution. This is really a disease that doesn't stop at our borders. Yes.
With certain businesses, restaurants, they have the ability to, separate tables, separate chairs, and create that social distance. More along the lines of barber shops, getting your hair cut. It's not really something that, it's a very hands-on thing. Do you have any maybe more guidance for someone who might run a salon out of their home or just a public salon, with being able to keep that social distance, but also, be able to cut someone's hair?
Sure. So the question is related to some of those services that are by definition hands-on. As was in previous orders and is in the White House orders, those services that are by definition hands-on will be very difficult to do under this current order, and that's by design. That is the highest risk situation. And the White House directives, as well as the CDC directives and the state previous directives, were all about that being one of the last things to move forward, being open. So again, our order very specifically does not call out any specific business, industry, or sector. Our order is really focused on risk. So as long as, according to the order, someone can comply with the physical distance requirements in the order, they are allowed to be open. Yes?
There are some groups or entities that have been evaluating states in terms of their social distancing performance, and ours is dropping rapidly. In fact, the one I read this morning was an F for Wisconsin, so it seems to me there's I would presume it's kind of a weariness, it's a long time, so can you speak to those weary travelers on, we're getting lower grades that we wouldn't want our kids to get those grades, so what about our social distancing grade?
Yeah, so the question is related to a national report, which I haven't seen, but I don't doubt, that indicates that based on some data that our social distance or our physical distance grade for Wisconsin has gone down to an F recently, is what was described. I'm not entirely surprised by that. I understand that there are challenges for all of us in continuing to do something that just doesn't come as natural to us as human beings, as keeping our distance. The goal continues to be to keep the circle as small as possible. So while this order does not mandate that you only stay with your household, you're able to be with groups up to the size of 10 people. It does ask and recommend and continue to encourage to make sure that you don't continue to spread disease. We will see more disease. That F grade, if that is in fact the truth, is because people are not necessarily seeing the seriousness of this disease. That's why we continue to have deaths in the state. That's why we continue to have disease. We will see more of that. We're confident of that. We do have an opportunity, all of us though, to flatten the curve of how quickly that happens and how many people get ill at the same time. I've shared previously that the longer we can go without a big curve of disease, the better all of us will be that end up being those that get very sick and hospitalized. I would rather get sick with this disease well down the road from today than today, because there will be better treatments and there likely will be something that will help me survive the disease. So that's part of what we need to think about. It is a difficult practice, but it isn't that difficult to say, 6 feet, I can still talk to you. And this order does allow small groups to get together. I think that will help people in understanding that we know social connections are important and doing everything by phone isn't always perfect, but it does say keep your circles small and don't have big groups together. So our ask is to continue to follow those premises of the order, and we're hopeful that we don't see that big spike in disease. Thank you, everyone, for joining us today. We know this is big news. We hope you take time to read the order. More importantly, the order to me is just only one of our very minimal tools in the toolbox. The most important tool we have is that people care about each other. So use that caring to continue those things that have kept all of us safer in this pandemic. Know that we realize it's difficult, and know that we're doing work to make sure that we minimize risk, but at the same time start opening our economy and start opening our community in ways that right now can be safe. We'll continue to look at that. We will be back tomorrow to share, as we usually do on Friday, an update, and we look forward to talking to you then.